Hello, Mr. Alatorre. My name is Shannon Moniger, and I'm presenting for Hutchinson Community College. This is my demonstration speech, and this is my audience. Hi. Hi, everybody. Thank you for coming today. I really appreciate your time. It means a lot to me. My name is Shannon Moniger, and I'm going to be showing you basic techniques of life support. We're going to be talking about how to properly do compressions. In 2005, the American Heart Association changed their standards on how we do CPR. The reason why is they researched our success rate of how many people we actually resuscitated, and they found that our success rate was not as high as they would like it to be. They compared it to some other countries, and they looked at Europe especially, and they found that over in Europe there was more focus on compressions, rather than here in the US we were always focusing on airway. So they found that actually by doing compressions, they were actually circulating more oxygenated blood to the brain and then back into the chest and the heart, and they were actually saving more people. So when they looked at our research, they found that when we had done 15 compressions, which used to be the regular standard, we actually had only done a couple correctly by the time we had finished 15 compressions. So they figured by increasing the number of compressions we did, we actually would be circulating better and doing better compressions so that we could actually circulate that oxygenated blood, preserve brain, because oxygen to the brain is what's going to preserve life, so that when they come out, if they come back from cardiac arrest, they're able to function normally. So what they did, 2005, the new standards came out. Our new standards are now 30 compressions and 2 breaths. And you do 5 sets of that. But the main thing is doing compressions correctly, okay? And if you look at this diagram right here, and you see the patient where they're placing the hands on the patient's chest, if you push down correctly, you'll actually you'll be able to circulate the blood back into the brain, and then it'll come back and fill the chest cavity. That requires you to actually take your weight off the chest. You don't need to take your hands off the chest though, okay? Finding correct hand placement is very important when you're doing CPR. A good rule of thumb is to always walk up the rib cage. You want to find that small little bone, which is called the xiphoid process, at the bottom of the rib cage, and always go at least 2 finger widths. You can also use the nipple line as a good landmark. You always want to take the heel of your hand, place it on the middle of the chest on the sternum. Then you want to be able to take your other hand, interlace it using all your weight, keeping your elbows straight, and you want to compress hard enough so that you're making that blood circulate. People always ask, well, how do I know if blood is circulating correctly or not? If you want to know whether you're getting that blood back into the brain and then back into the chest cavity, you can have someone check for a carotid pulse, which is located on the neck. If you move from the middle of the throat down to the side, you'll be able to find a pulse, and then you'll know you'll be doing compressions correctly. Does anybody have any questions? I really appreciate your time, guys, and thank you for coming today.
And actually, what's